Hello and welcome. I'm Colleen Kmiecik with the Autoimmune Association, and I'll be your moderator for today's webinar. Thanks for joining us today. Whether you're newly diagnosed or have been managing your condition for years, we hope today's session offers both insight and encouragement. Our guest, Dr. Monica Shah, is a board-certified rheumatologist, fashion model, and reality TV personality. She brings her whole self to the practice and invites us to do the same. Joining us will be panelists Jamie Nicole and Dayna Pham. Both are autoimmune patients and active participants in managing their whole health. Throughout the conversation, Jamie Nicole and Dayna will reflect on Dr. Shah's insights by sharing their own lived experiences, adding powerful, real world context to each segment. Their voices are an essential part of this dialogue as they can reflect on their personal adaptation to some of the strategies outlined today. Let's begin with you, Dr. Shah. You have such a fascinating story. Would you mind sharing a bit about yourself and why you decided to pursue rheumatology as a career?
Hi, everyone. Thank you so much for that kind introduction. And yes, so originally I planned on pursuing journalism and mass communications. And I grew up in a family of doctors. My dad is an internal medicine physician. So it was in college that we went on a mission trip in a rural third world country. And that really was the shift that I needed. And seeing that impact that we brought to those patients in that country really changed my mindset and what we were able to do. And what doctors were able to do and people in healthcare were able to do. And so I saw that long-term relationship that not only that he built with those patients in that country, but also what he did back home. And I think that's what inspired me to change my trajectory into medicine and rheumatology specifically because it allowed for that same deep connection with our patients. These are chronic illnesses that we're dealing with, and we often walk through patients throughout their lives with them. So I thought that was really special. And what excites me most about rheumatology is that it's rapidly evolving. We have so many new innovative treatments. We're offering real hope to our patients living with these autoimmune conditions. And in many ways, I've come full circle with things such as this podcast to allow me merge my passion for mass communication and journalism, but also committing to educating patients and helping them with their lives and controlling their autoimmune disease.
That's great. Thank you, Dr. Shah. Jamie Nicole, could you share something about your patient experience?
Of course, and thank you for allowing me to share my story with you all today. It's a very interesting story, or so I think. I just started out wanting to lose weight. I had a number of symptoms starting out when I was going to my doctor for my regular checkups. A1C was a little elevated. My good cholesterol was low. I had joint issues. I was fatigued, but in my mind, even though I had a family history of it, because of my lifestyle with the kids and with my job, I thought the symptoms were normal and they were common. They weren't normal. I was just trying to lose a couple of pounds. And I was following someone who said, if you're doing everything right, you're eating right, you're working out, go and get your hormones checked. And so that's what I did in 2015. And little did I know, I was diagnosed on that first visit after the lab work with Hashimoto's thyroiditis, and figured that's the reason why I could not lose weight. And so with medication and some lifestyle changes, I was able to drop some weight in a little bit of time, but also I felt better than I had my entire life. I always liken it to someone who has gotten glasses for the first time. Like, I didn't know how blind I was until I got glasses, but I didn't know how sick I was until I got that diagnosis and was able to get some help. So from that, that inspired me to become a health coach. But what I did wrong is I did not fully understand the full scope of autoimmune disease. And I went right back into the, type A personality, hardworking, not focusing on stress, not focusing on sleep. And so after a while, my symptoms became worse. And I could not figure out what it was, specifically the fatigue. And so it was a matter of years where I was still suffering. I felt a little bit better, but my fatigue was getting worse. And so I was going through a series of tests with my doctor. We thought it was coming from an Epstein-Barr flare. I got treated for that. That didn't help. I had a problem with fibroids. That didn't help. And then finally, I believe it was 2018, she recommended me go get a sleep study. And so I did that. And 4 years later, after the first diagnosis, I was diagnosed with narcolepsy type 2. So now I have two chronic illnesses that I'm dealing with on top of one another. So after all of that and try to figuring out, I thought I was going to get some relief with medication alone, but I still at that time did not know the full scope of autoimmune disease. And so it wasn't until the following year, I had already gotten a certification to become a holistic health coach, but I got an additional certification to learn more about autoimmune disease specifically. And that's what kind of changed everything for me. Um, the medication for the narcolepsy wasn't a smooth path. I had to incorporate all of those things that we talk about: stress reduction, mitigation, managing my symptoms, tracking my symptoms, trying to put those pieces together. And so once I was able to do that, it wasn't as though I didn't have the symptoms. It wasn't as though I was never in a flare, but I had tools to better manage them so they weren't as long and they weren't as severe. And so what I've learned over the process of this is not a linear journey. There's ups and downs, and you really have to stay on top of it. And so after that certification, 3 years later in 2023, because I was equipped with those tools and that knowledge, unfortunately, because of some shoulder issues that kind of tipped me off and some other, I guess, symptoms with the rash on my face, I was also diagnosed in 2023 with rheumatoid arthritis. Ended up having a double surgery on my rotator cuffs from then. So again, my story is an interesting one. Had I not been trying to lose a couple of pounds, I don't think I would ever have found out any of this, or it would have been delayed. But I didn't do everything perfectly throughout this journey. It's really about staying curious and being consistent and being an advocate for yourself. And that's why I'm passionate also about being an advocate for others.
Wow, that's fantastic. Thank you so much, Jamie. What about you, Dana? What can you tell us about your journey?
Thank you so much for sharing that, Jamie Nicole. That was beautiful. I'll start with my journey. It started at Coachella when I was 21. You know, when you're 21, you feel invincible. But after Coachella, I started having red bumps on my back. So then I checked Google, and Google said it was bed bugs. So I was like, it'll be fine. But then it got worse every day. So then I saw my primary care physician, and they said maybe it's contact dermatitis because I was laying around in grass at Coachella. So then I got an urgent referral to a dermatologist. You would think that urgent means urgent, but then it was a 3 month wait list to see a dermatologist. But I understand, like, everybody's waiting for care. I couldn't be mad about it, but like, I was getting worse every single day up until that point. Thankfully, I got in after 2 months due to someone canceling, but by that point, I was like already hating waking up every day because it wasn't red dots on my back anymore. Now it was turned into plaques that spread around my body. And by the appointment, I had like plaquey lesions on my back, my arms, my legs, my scalp, my face, torso, private areas. And it literally spread so fast. It was insane. And at that appointment, I was diagnosed with psoriasis. And just want to clarify that like psoriasis is not contagious. So we think that could have been a result of the environmental stresses at Coachella, like the crazy heat and the dust, maybe an asymptomatic sickness for me, maybe some genetic underpinnings for myself, something like that, but not contagious. But since then, I was struggling with insurance prior authorizations because we were trying to get me on a biologic for my because it was like all over my skin. And the lack of transparency with the prior authorizations worsened my mental health because I didn't know when I would get better. Every single day I would get worse, and there was no hope for me. And with the 100-degree heat wave, I was living in LA at the time. I just felt disgusting, sticky, like it was stinging all the time. Quality of life was terrible in my last year of college. And I was also studying for the MCAT at that time to be in medical school, but I had to stop and postpone applying because I literally couldn't focus on anything. I couldn't sit for over 15 minutes at a time because of the irritation behind my thighs, because behind my thighs, it was covered in plaques. So I just couldn't do things that I wanted to do or things that reduce stress anymore, like volleyball, working out because sweating made my skin burn. And thankfully, I ended up getting approved for my first biologic, which cleared my skin in 1 month. And I was like, I'm done. Like, I got on the right medication and I'm good forever. But 1 year later, I developed back pain. But in the time where my skin was clear, and thankfully, since that time, it's been clear till now. So again, like 1 year later, I developed back pain, but I dismissed it because at that point, since I was better with my skin, I was studying for the MCAT again. I was applying to medical school, but it kept worsening progressively. And I knew something was wrong when I couldn't walk around the mall without sitting down every 15 minutes. And by that point, I was 24. And that was just not normal for a girl who's 24. So I went to my PCP again, and they were like, it's likely due to your sedentary life. And they sent me to PT. But then after 3 months of PT, as in physical therapy, nothing helped. I'm from a low income area in San Diego. So there's a lack of access to specialty care in my area. So I waited till I got to med school here at University of Chicago to see a rheumatologist. And I saw a rheumatologist. And the only opening was, or like the earliest opening was on my first day of medical school orientation. So I got diagnosed with psoriatic arthritis on my first day of med school orientation, which was crazy because it's supposed to be like the best day ever, start of my medical school career. But in reality, it was the end of a life without physical disability that is diagnosed. So, crazy day. I cried in my dean's office because at that point I could barely walk. I couldn't sleep at all because I was in so much pain and I would have to like switch positions all the time because I would not get comfortable ever. So I stopped socializing. I stopped going to class. I couldn't even cook. I couldn't unload my dishwasher. I just couldn't do anything. So my rheumatologist, who's not a psoriatic arthritis specialist yet, suggested I switch to other biologics that she was familiar with. But due to lived experiences of my peers who were on those drugs before and they had breakthrough skin symptoms, I wanted to explore other options because how severe my skin symptoms were before, like 40% body surface area, head to toe coverage, high impact areas, all of that. So I reached out to my mentors and they said that I can consider looking into particular biologics that are efficacious for both skin disease and axial disease, meaning like my back pain that I was having. But then my insurance denied me twice for the drug that was particularly effective for axial disease and skin. And I was told to do step therapy, which means I try two of their suggested cheaper drugs plus 6 months of moderate benefit on another drug that is cheaper for them. But that would take at least a year of me trying and failing different things. And that would be a year of debilitating pain. But I need to start med school here. So I reached out to the manufacturer of the biologic that was denied to me, and I was able to get on a bridge program for people with insurance denials. And I got on the medication, but it was just not, I still was anxious because I was still uncertain if my insurance would approve it. If the program, like when the program runs out in 2 years, if my insurance doesn't approve it, then I'm screwed. And by this point, I was in debilitating pain. I was taking the max dose of my NSAIDs and my painkillers every single day. And I would have to like lay with a heat pad, bring my heat pad to class. Um, and eventually I got insurance approval, thankfully, because they were working with my insurance company. And within 1 week of starting the med, I was already feeling immense back pain relief. And within 1 to 2 months, I was literally back. I was volleyball captain of my class's intramural volleyball team, walking to class, socializing, all of that. So the power of medication is real. The access to the medications could be the problem. But thank you. That is my journey up until now. And I'm doing okay now.
Wow, Dana, I'm glad to hear that you're doing okay now, and that's quite a story. Thank you so much for sharing all of that with us. Let's dive now into integrative care. When someone is first diagnosed with an autoimmune, the focus is often on managing symptoms, but wellness is really about so much more. Dr. Shah, your approach is fascinating in that you're actively seeking to redefine what remission means. Can you tell us a little bit about that?
Yeah, so for me, integrative care is not about just treating the labs or treating the condition, it's about treating the whole person. So we're looking at inflammation through different lenses. And I'm looking at it through a nutritional aspect, I'm looking at it through sleep management, stress management, gut health, and even mindset. So we're taking the whole patient into account here. And so while Dana, emphasized the dramatic effect that medications have on these conditions, it's also important to pair them with lifestyle changes. And together, that is the most powerful tool that patients have. And I always aim to empower my patients to use evidence based tools and to complement their treatment plans. And collectively, the combination is severely impactful for the patient.
So, Dr. Shah, so many patients get to that point where they start to ask themselves, is there any more that I can be doing? And really, this is beyond not just managing their illness, but to actually shape their wellness. It's that shift from being a passive patient to uh, an active patient. Can you speak to that?
Yeah, so I think the shift in mindset is key because the patient asking that question means that they want to take control of their health, which I think is crucial. These types of autoimmune conditions, or all autoimmune conditions, are introspective. So it really starts with the patient asking themselves, what can I do for myself, rather than blaming themselves? What am I not doing? So I think that shift in mindset is so important. And that's when they start to take charge of their health. I work with the patient at where they're at. We have to sit down and digest what really are their goals. What are their important aspects that they want to achieve? Is it more fatigue improvement? Is it joint improvement? Is it the ability to do things with their family? Really, what is the initial goal in mind? And then we start looking at smaller changes that they can make in their day in and day out lifestyle. And once they start tracking those symptoms and making those changes and noticing the benefit, that's really where it's like a domino effect. And they're more encouraged and more likely to look at other parts of their lives and say, well, what are the other changes that I can make? And go step by step. So it's not an all or nothing approach. It's really, let's start with one thing, let's go small, and then we'll go incrementally and add in smaller changes. And ultimately, it leads to a bigger impact.
Okay, great. So when you're thinking about the whole person, the whole patient, do you also consider inflammation as a core issue? And if so, how do you help patients understand that connection between inflammation and other symptoms like pain, fatigue, brain fog?
Yeah, so inflammation is at the core of almost every symptom we see in autoimmune disease, not just joint pain, but also fatigue, mood changes, brain fog. So I explain to the patients that inflammation isn't just something we see on labs, but it's also something that they feel every day. And so once they understand that these symptoms are all interconnected, I think it empowers the patient to take a more active role in managing their health. And we talk about medications, and we know that medications can help reduce inflammation at the cellular level, but it's also important to talk about how inflammation can impact sleep. Again, we talked about different lenses of inflammation: sleep, nutrition, stress management, movement. And it's all about connecting and interconnecting those dots between what's happening on the inside of their body and how they're physically feeling.
And then when it comes to autoimmune conditions specifically, do you find that certain lifestyle pillars such as nutrition, sleep, stress, movement, do any of those tend to move the needle more for wellness more than others?
Yeah, I think for me and my personal experience, sleep and stress management are often the two that move the needle the most, sometimes even more than patients expect. Poor sleep and chronic stress can drive systemic inflammation and worsen symptoms like joint pain, fatigue, brain fog, several other symptoms. And there are several studies, especially as a rheumatologist, that have been published in different articles and journals that highlighted that disruptive sleep and stress dysregulation are chronically linked to increased disease activity and inflammation. So once we improve those two pillars, those are my starting points. Everything like energy, mindset, digestion, all that tends to follow. Now, I don't want to neglect nutrition and movement; those are equally important for us. But it's easier to build upon, in my personal experience, once the foundation of rest and emotional regulation that's been placed. Once that foundation has been laid, it's easier to then start talking about nutrition and movement. But I always tell the patients, again, it's not about doing everything at once, but it's just starting where their body feels the safest, and then just, again, building up little by little.
That makes a lot of sense. Thank you, Dr. Shaw. This has really been a great picture of what care can look like to help a patient redefine their version of wellness. I'd like to ask Jamie, Nicole, and Dayna, how have some of these ideas shown up in your own experiences? Let's start with Dayna. Can you share with us what remission means to you, Or have you ever been told clinically that you were at a point in remission and you advocated for yourself to get better results?
That's a great question. Then the definition of remission, I feel like depends from person to person. And one of a psoriasis expert named Dr. Andy Blauvelt came up with this analogy called the cockroaches in the kitchen analogy. So for me, remission for my skin means clear skin because if there's one plaque, that means there could be more. Same thing with cockroaches in the kitchen. Like if you see one cockroach, if let's say that's infested with cockroaches and you get down to one cockroach left, you're still not happy because you know they might be reproducing in the back, or you know that they're like more might come out. So just because there's one left and there used to be a million does not mean that you're in the place that you want to be yet, because you still have the fear that it's not fully like treated yet. But remission means different things for different people, especially with different levels of their skin disease. But for me, I have the privilege of saying that remission looks like clear skin as well as minimal joint pain. I still have some stiffness here and there on my period, when it rains, after flights, but that's just like regular inflammation stuff and nothing an NSAID can't fix. Whereas before, like even the max dose NSAID plus max dose of a painkiller did not help. But regarding your second question, no doctor has actively used the word remission with me in any appointment. But I think this is a great point because I was on a panel with psoriatic disease experts and they were talking about what remission means to them. But they reminded all of us in the panel that patients define for themselves what remission means, because the clinical endpoints, like in research, could not be as important to a patient's experience. Like to them, it's their quality of life, and that's up to them to define and them to define only. Um, After living a life fully covered in plaques, like maybe to some people, remission means having one or two flares left. But for me, again, I have the privilege of achieving PASI 100 or completely clear skin, and that's what remission means to me.
Yeah, that's a really important point. Remission really is personal. So thanks for touching on that. And for you, Jamie Nicole, you've been really upfront about your dedication to a healthy and engaged lifestyle and how that's played in managing your own symptoms. Can you share any approaches to managing inflammation that particularly felt empowering or effective?
Absolutely. But I just want to add in a caveat because so many times when I'm on panels as well, the other panelists have gotten diagnosed much younger. So I come from a little bit different perspective. I didn't get diagnosed with my first autoimmune disease until I was 35 years old. I had a long history of habits and ways of thinking about health that had already built up. So it took me some time, and I'm a little bit stubborn, to realize that this was not going to be something that I can go in and fix like I was Superwoman, that it was going to be something that I'm dealing with for the rest of my life. And so, like Dayna, I don't like to use the word remission because, as I said at the beginning, I've been diagnosed with something every 4 years. And because of those multiple diagnoses, every way I treat those the new autoimmune disease or the narcolepsy is a little bit different. And then something else pops up and I have to research that and manage that a little bit differently. So for me, I always like to use a whole person approach. And that varies. I've learned to tweak it depending on what's going on in my life. So yes, I focus on nutrient density. The number one trigger for me is stress. So I've learned how to manage that. Sleep, supplementation, all of that is good. But depending on what I'm going through or what my goals are at a particular time, that may change. The way I was able to manage my symptoms prior to knee surgery and prior to shoulder surgery is a lot different. I don't have the same endurance. I used to be able to get up and go running and do and go to the gym and do all of those things. And so mentally, I've had to train myself, Jamie, it's not that you can't move anymore. You just have to move differently. So I'll change my supplements. I'll change my sleep routine based on what I have going on at that particular time. And again, I just want to emphasize, these aren't just like wellness habits that I just throw out there. These are tools that give me back agency. When we're talking about patient perspective, I think a lot of times people don't talk about enough the mental toll that this takes on you. And so for me, being able to have these tools, even though it's not fully in remission, even though I don't have full control over my body, mentally, the tools give me a little bit of control over something that I didn't think was going to take over my life this much. So it helps me mentally as well as physically. And so also these tools and learning and getting on webinars like this and learning also gave me the tools to be able to catch it early. The doctor mentioned earlier, tracking your symptoms. Had I not had that education, had I not learned from someone else the importance of tracking those symptoms, I wouldn't have been able to catch it early. And I was able to mitigate some of the disease progression because I did catch it earlier rather than later. And so for me, that's how I've been able to manage, number one, my inflammation, and then manage anything else that happens to pop up autoimmune wise as I continue on this journey.
Thank you, Jamie Nicole. So we all know that managing autoimmune disease often means juggling multiple doctors and appointments, right? And it can be so exhausting. But sometimes patients are left feeling like they're the only ones connecting the dots. So let's talk about what true integrative care looks like, how patients can build a strong care team, and what it takes to go from a fragmented treatment to collaborative wellness. Let's start with you, Dr. Shah. What does an ideal integrative care team look like for someone who is managing a complex autoimmune condition like psoriatic arthritis or psoriasis?
Yeah, so it is just that. It is a team. This is a very collaborative type of condition to treat. So we're talking about rheumatologists, dermatologists in Dana's case, physical therapists, maybe endocrinologist, in Jamie's case. So we're bringing the whole team together, and it starts with the PCP managing, the underlying comorbid conditions, whether it's diabetes or cardiovascular risk. We're looking at physical therapists in terms of movement, and we're talking about nutritionists when it comes to nutrition and the foods we're eating, the rheumatologist to manage the joints, the dermatologist to manage the skin. So it is just that. It is the whole team, and everyone communicating with one another is really the important part here. And we all, in the real world, we all work in different health systems and have private clinics, and we're not all under the same umbrella. And so that's where the patient really is the center of focus and is the key player within the team. Yes, we all have our own goals, but I always say the patient is the ultimate team leader here. And that's really because their voice is the one that matters. They're the ones that know their body the best. And so when you think about fragmented care, it can happen a lot because you have so many different providers, right? The team is a big team. It may have conflicting evidence from different provider to different provider. The patient may get confused on which doctor do I need to tell this symptom to. It may not be obvious or may not be clear. And so it gets overwhelming for the patient in that aspect. So I think allowing the patient to have that safe space of just letting your doctor know, hey, I'm overwhelmed. I'm not quite sure who I should tell this to, but I just thought since I'm here, I would address it with you and maybe you can lead me in the right direction. I think just having that open conversation and giving the patients that safe space to voice that concern or that overwhelming feeling is really where we can kind of bridge the gap in fragmented care. And honestly, the patients, like Dana and Jamie have been so empowered themselves. And I think that comes with knowing that ultimately this is in their control and it's a very intentional condition, the choices they make, the doctors they pick, the treatments, it all should be a collaborative effort. But it all starts with the patient being the center of focus and being that voice to almost bridge that fragmented care.
Yeah, that's great. I think that's what all patients really are looking for. Do you have any examples that you can share a story of when everything just did come together, everything clicked, and all of the providers are communicating and the patient feels truly seen? And what's that like from your point of view?
Yeah, so I have several cases, but just to generalize, I had a patient, a young female with psoriatic arthritis and psoriasis, diagnosed a very similar case to Dana's, interestingly enough, and that led to a series of just questions. She didn't feel good. She led to a lot of anxiety and depression symptoms. Because of that, she really didn't get out of her house. She felt embarrassed. She wasn't moving her body. Her nutrition suffered. Her physical health suffered, and so we brought the whole team together in the sense that I recommended a dermatologist that I speak with, and I communicated with them on the side. I let the patient know that, this is a relationship that I built with this dermatologist. So we collaborate care. I also sent her to physical therapists that I work with. I sent her to a nutritionist that I work with. So it's nice when your doctor has a team of people they already trust, and know that that open line of communication is already there. And we got her in the right hands. We told her it was going to be a journey, several different providers. Everyone has their own 2 cents to add, but I think complementing each other, and then making it what fits for her was the ultimate goal. And within a matter of a few months, she saw that that needle shift, as we like to say, and her skin started clearing up. She was coming out of depression because she wasn't feeling good. Now she's feeling better. Her depression symptoms got better. She was motivated to take care of her health and her physical fitness. So it all just dominoed and it worked out. But again, it's all about your doctor knowing the right providers to send you to and making sure that they also are in communication with one another. But she's happier than she's ever been. She has control of her life again, and that's really, I think, the ultimate freedom. And that is the best gift that any patient with an autoimmune disease can have, is they feel like they have their life back and they have control.
Yeah, I mean, really, that is the most important thing. Dr. Shah, thank you for helping us better understand what coordinated care can and should look like, and the importance of aligning the many players on a care team. Jamie, Nicole, and Dayna, now let's talk about some of how those ideas resonate with your own experiences. Let's start with Jamie Nicole. Can you share a time where a provider really listened to you and helped you feel like a partner in your care, and what did that feel like?
Absolutely. As I mentioned earlier, when I was just trying to lose weight, I also heard, I guess, horror stories from others about doctors not listening to them. So I did take some time and do some research on this doctor. And so what I liked about her is that she had a checklist for me every time that I came in for a visit. So it wasn't just based off of labs. She really took the time to dig deep. And she was the one who helped me with all of my diagnoses, even though I was referred out to a specialist. So I really lucked up on that. But when I was sent out to different specialists, I had to do a little more work. So what I started doing was I keep a binder of everything. I have a section for each type of doctor. And so making sure that even if they're not a team, I am the captain of my own team, and I'm sharing that information because it really does cut down on the time that it takes to eliminate all of those things. You might not get to the answer, but I can eliminate a lot if the doctors have all of the information. Technology has changed over the years. Sometimes I'll upload that into my chart and provide the information before I even get to the doctor's appointment. And if I get my lab work back, I'll take the little time to review it myself before the next doctor's appointment and request any labs to follow-up labs to do before my next appointment so that I can make that go a little bit faster as well. So for me, it's just about managing my own care regardless of the type of doctor that I have, because not everyone has access. There's a doctor shortage. And so you really do have to make the most of your time in the office and your time out of the office.
I love that. Thank you, Jamie. You really are a great example of being a self-advocate. So thank you for sharing that. And Dana, I know your story is one that has put you in the role of also playing an active partner in your care. Have you ever had to play the role of go-between with your doctors? And what suggestions do you have for other patients who are facing a similar scenario?
Yeah, I have had to play the go-between because, dermatologists and rheumatologists, they have different expertise. And I felt like my rheumatologist, who isn't currently a psoriatic arthritis specialist, was prescribing what was good for my joints and potentially not for my skin. And I don't blame them for that because that's not their expertise. But some clinics have multi-specialty care, like rheumatologists and dermatologists work together. And that model is so amazing. Regarding suggestions, I would say to try to find a psoriatic disease expert in your area. And there's so many organizations that will tell you who's an expert in your area because there's a difference between a rheumatologist versus a rheumatologist who's a psoriatic disease expert, and then a dermatologist versus a dermatologist who's a psoriatic disease expert. And I feel way more validated and understood by psoriatic disease expert providers who I've met. But unfortunately, many areas like low income areas and under-resourced areas just don't have access to these providers. But I also understand that this is a privilege, and sometimes your symptoms are so bad that you just need to see any doctor who has openings, any doctor that takes your insurance, or when money is short and you just can't be seeing all these specialists, and it's hard. So when you're in survival mode, I know it's hard to do the research and make the calls. I acknowledge that, and I believe in you. That's all.
That's a really important message, Dana. Thank you for saying that. So, when we think about autoimmune disease, the conversation often starts with medication, but we know that optimum remission really asks so much more than that. It's about how we eat, how we move, how we manage stress, how we care for our whole self, not just the diagnosis. Dr. Shaw, you clearly embody a healthy, balanced lifestyle, and that comes through in the way that you practice medicine. How do you talk to your patients about the idea of treating the whole self and not just the individual symptoms?
Yeah, so that is the whole integrative approach is we're taking what Western and traditional medicine and we're putting it all together. And so we're taking evidence-based treatment and we're taking evidence-based lifestyle choices and putting it all together. So a lot of patients, the question I was always asked, well, am I on this forever? Like, I don't want to be taking a bunch of foreign meds, and that's a really scary thing for a lot of patients. And so that's really where that whole mindset comes into play is we can, at least for me, I tell them that I can use the least amount of medication necessary if we can collaborate care from both ends. So there's a lot the patient can do on their own in terms of the healthy lifestyle choices that they make that will rapidly decrease that inflammatory response. And then we can start out with the medication and see, okay, well, we may not need to add more because collectively this is doing enough. So I think putting that into perspective in terms of dampening that inflammatory response from both sides, the stuff that I can prescribe and the stuff that the patients can do collectively will lessen the amount of overall treatment we need. I think is really eye opening for the patient to realize that because I think going in when you're diagnosed with any sort of autoimmune disease, all you think about is, oh my gosh, I'm going to be on a bunch of new meds for the rest of my life. And that in itself can be very daunting. But we know, as Dana said, there's environmental triggers or stressors. As Jamie Nicole pointed out, there's things that physically impact that inflammation and how patients feel. So think about the importance for the patient if they can say, wow, I can just look into certain habits that could be triggering and I can change the way I'm doing certain things to lessen the need for medication. I think that in itself is eye opening for the patient. And I think that's what changes the shift in mindset to really think about integrative care in this way. So it's complementary medicine, is what I like to call it.
Sure, absolutely. And a part of that is nutrition. Let's talk about nutrition for a minute. We go online looking for advice and we see so much about eliminate this, avoid that, take this supplement. This worked for me. How do you help your patients determine what's the best option for them and help them find a way of eating that truly supports their body?
Yeah, so we're inundated with information. I mean, you can go in the grocery store aisle and there's magazines of this diet and that diet, and it's just everywhere, right? It's overwhelming how much information is out there when it comes to nutrition. And I understand how it can be overwhelming for the patient. They really just don't know what's the first step to take. And so I really like to table back to what's evidence-based as a doctor, as a scientist, I like to say. I want to go back to the science and what does the science prove us? And so really what we know about the clinical studies that have been done about nutrition as a whole, the Mediterranean type of lifestyle and dietary choices are what's widely accepted throughout all generalized all autoimmune conditions. And I don't want to get into the specifics of each one because, again, like Jamie Nicole pointed out, she has 3 different conditions that all may require different types of nutritional aspects. So it's not always like a blanket, like, just follow this diet and you'll be good. But I like to emphasize the importance of the Mediterranean concept as a whole to the patient because that is what's been widely accepted and shown to decrease inflammation. And those are, choices like eating a diet that's rich in fruit and vegetables, whole grains, beans, healthy fats. We know, as Jamie Nicole pointed out, there are certain triggers, right? She has certain triggers for her symptoms. That may be refined sugars, that may be red meat, it may be excess saturated fats. So, again, it's a very intuitive condition. And I always tell the patients if you eat something and you don't feel good, either your joints feel good or your skin feels terrible or you feel more tired, that is your body inherently telling you that this is just not for you. This is not for you. It doesn't mean you have an allergy. It just means you have, you know, um, a sensitivity to that food. And maybe that's something that's just not for you with the conditions that you're dealing with. So, overall, it's important to lean in on what your body feels good eating. But the best guide I have, or the best advice, just to start off that conversation, is having the patient look into the Mediterranean type of lifestyle and figuring out, okay, well, these are foods that I'm not eating a lot of and I could implement more of, and cutting back on the things that maybe they're more restrictive or things that don't make them feel good. So it is a very back and forth and introspective um, situation for the patient in terms of dietary choices. But like I said, your body doesn't lie. And when it doesn't feel good, you'll know.
Right. So let's talk about exercise for a second, or really even just general movement. And what do you typically recommend to your patients when they're having a flare or when they're just getting started?
Yeah, so when patients are flaring or just like beginning their journey and starting to exercise after being diagnosed with an autoimmune condition, I always like to stay and emphasize the importance of low impact activities that maintain joint mobility without exacerbating pain. So it's like this fine line that patient has to walk, and really only they can walk that line of understanding when it's too much or not enough. So I always say, patients don't have to run and do high intensity cardio or have to jog and run, 2, 3 miles a day. It's really finding something that they enjoy that they can be consistent with that's easy and forgiving on their body. Things like walking, swimming, yoga, Pilates. Those are just some examples of types of, exercises and movement abilities that patients can implement. And that can, combining that with like breath work and meditation and using that as a whole. And then, moving your body, at least I say 30 minutes, 3 to 4 days a week. So giving your body that ample time to rest in between is also important. And then over time, they'll build that confidence back. They'll build their strength back. And then maybe they'll find newer activities to implement that also make their body feel good. But again, it's not an all or nothing. It's not do it all or do none. It's finding again slow things that they can implement, and then discovering what else their body is capable of handling in a gentle way.
Oh, great. Thank you. That's really helpful advice. I mean, it really isn't just about one system or symptom. It's really about restoring balance across nutrition, movement, emotional well being, and so much more. I'd love to see how patients have integrated this into their own lives. So let's start with Dana. You mentioned meditation and rest. How have those helped you manage inflammation or even your stress-driven flares?
Yeah, I would do yoga and mindfulness practices because at that point, when everything is flaring, you already feel like you have no control over what's going on in your body. So, those moments, as small as they um, are things that you can control and where you can feel reconnected with your body. At least that's how I experienced that. And also, when I started incorporating yoga into my daily life, only like 20 minutes a day, I was not doing all that. It was so helpful for my stress because I had something active to look forward to that my joints could handle. And it also helped with my identity as an athlete as well, because like at that point, I just didn't feel like an athlete anymore when I used to play volleyball all the time. But regarding the stress driven flares, aspect, for me, less rest meant more stress on my body, and more stress on my body predisposed for more inflammation. But sometimes I can't even control how much rest I get because I only rest when the psoriatic arthritis lets me rest. So it's hard to get comfortable when you're flaring. But overall, I think the life of having a chronic illness is to try to be mindful, relax as much as you can, and try your best.
Yeah, I love that you said that yoga helped you feel a little bit more like yourself as an athlete. That's really important. Jamie Nicole, you've talked about exploring changes to your own diet and exercise. What has been the most helpful insights that you've had about the links between food and inflammation?
um, that what they have told us over the years is not necessarily true if you have an autoimmune disease, basically. For me, I had to find out what my triggers are. I thought I was eating food that was good for me because it was labeled as healthy, but it ended up causing me to have flares. So for me, initially, it was the autoimmune protocol that I just used as a tool. I don't follow it strictly now to figure out what my particular triggers were. And then I moved into a paleo Mediterranean type diet. But also, as I got another diagnosis, me managing the fatigue, intermittent fasting helped because I wasn't digesting the food first thing in the morning. I can get up, go get some sunshine, go for a run, come back, take a shower, eat my food. So learning to meld all those together and stay off of the internet was very, very important. And then actually also over the years, that can still change. So it's not a one and done. As I move into different diagnoses, whether it be, perimenopause, issues with testosterone, my food has had to change. My supplements have had to change based on my condition at that time. And being aware of that and not thinking that this is a one and done has really changed how I'm better able to manage the condition and it not manage me.
That's really, really great. Thank you so much for sharing that. So let's move on to becoming your own advocate. Advocacy is really more than just speaking up for yourself. It's about believing your body, believing your story, and really fighting for your right to be heard. So, Dr. Shaw, I want to talk about what it means to engage in shared decision making. I know from my own experience that sometimes it feels like decisions are being made about me, not necessarily with me. Between specialists, appointment, and flares, the system can feel so overwhelming. And speaking up, I mean, it really isn't always easy, especially when you're so tired and exhausted and not really sure what to ask. So, I want to ask you a big picture question. For someone living with something as complex and unpredictable as an autoimmune disease, what does it really mean to be your own advocate?
Yeah, that's a great question. And being your own advocate for me, if I were a patient, just means trusting what your body is telling you and speaking up, even when it's hard. It's asking the questions. It's tracking your symptoms. It's knowing that your voice matters. You don't need to have all the answers, is what I like to tell the patients. You just need to stay engaged and never stop showing up for yourself. I mean, we have two patients here that have really advocated and stepped up for themselves. And I think that's really pays dividends in the end and to feeling better faster. And again, it is a collaboration. We talked about a multi-specialty team approach, and the patient is always at the center of it. So speaking up, even though patients might think, oh well, speaking up is disrespectful, or I don't want to be disrespectful. I say speaking up is being responsible, and really, I mean, for my patients, I say that I validate what they're going through, because the medical system is tough, and it's tough not only for the patients, but it's tough on us, and really getting to the patient and seeing them. So we want to make sure that, as a whole, in healthcare, that patients are being heard and validated. But it's showing up and not stopping to show up even when things get hard, because really, your body. I always say to my patients, you know your body better than I do. And so you have to tell me when you don't feel like things are right. The first question I always ask every patient in the room is, tell me how you're doing. How have the last 3 months been for you? And we don't see each other often, right? And maybe every 3 to 4 months. So a lot can happen in that time frame. And Jamie Nicole did a great example of saying, she shows up with binders, she has her logs. So it could be tracking in various ways, whether it's photos, whether it's jotting symptoms down, but only you can tell us if things are working out. We have labs as a guide, we have our physical exam, but everything in between, there's so much can happen. And that's where I tell the patients, your voice is really what matters in the end, because we could be staying on treatment that may not be ideal to stay on at that point, and we wouldn't know any better. We use the labs, like I said, as a guide. We use our physical exam as a guide, but ultimately it's the whole patient approach again.
Yeah, I think that's so important. I love what you said. Speaking up is responsible. I think that's just an absolutely great message, and I'm so glad you said that. And I'm glad that you talked about, you have the labs as a guide. I know for myself, as an example, I've been told so many times that because of the labs, I'm fine, or some patients are told it's all in your head. So, how do you help your patients reclaim trust in themselves and their experience?
Yeah. So the patients that I always say, like, if they're told it's all in their head, well, I would rebuttal and say, well, my head, or I don't feel good. So it's really just how I'm feeling overall. So I think it starts by when you're told that it may all be in your head. It's about, I don't want to say rebuttal in a negative way, but it is really just about voicing that concern of saying, well, listen, I know what my body's been through in the last 3 months. And again, it's not the ones that are feeling most empowered, that are going to take control of their health, aren't the ones that are on this perfect routine. They're the ones that are staying curious. They're the ones that are tracking. And so it's really important for the patients that feel like if they don't have a voice, I always say, and we talked about access to care being difficult, but if you're in a position where you could seek care from another provider, where you are feeling more seen and more heard, ultimately that will lead to a better outcome. But patients may not be as fortunate enough to have that opportunity. And in that case, I think it's really about continuing to advocate for yourself, and vocalizing that, listen, I'm not feeling good. Look, these are what my joints have looked like. This is what my skins look like. I've been sleeping several hours a day. I'm not used to doing, I'm not doing the things I used to do. only your voice can shift what we're thinking. And again, that's speaking beyond the labs at that point. So I would say, just continue fighting for yourself, because this is your health, and you are the captain of your health.
And you kind of touched on this just now, but I mean, sometimes being your own advocate really means making tough decisions and getting that second opinion, or sometimes even leaving a provider who isn't listening to you, which can be so intimidating, especially if you have a long history with that provider. So, how do you help someone find the courage to do that?
So I personally like to create a safe space for my patients. I can only imagine being in their shoes and talking to so many different providers and having to be very vulnerable for something very personal. So it can be very hard to speak up, especially when it means questioning a provider or seeking a second opinion sometimes. But again, we talked about the responsibility that this brings. Having an autoimmune condition and living with chronic illness is also a responsibility that the patients have to carry. And your health is too important. What I tell my patients, your health is too important to stay silent. And if something doesn't feel right, it's probably not right. So I encourage my patients to focus on what they deserve, much like anybody else, is to be heard, to be respected, and to be treated like a partner in their care. And so just sometimes hearing that, you are allowed to ask for more, you are allowed to ask questions, you are allowed to wonder if this is the correct treatment, is enough sometimes to give them that courage to continue asking questions, even if it's with other providers.
Great, thank you. Dr. Shaw, it's clear from what you've been sharing that wellness, it really includes being seen, heard, and respected, not just treated. For many patients, participating in these shared decision making can feel so overwhelming. They may have been dismissed or simply too exhausted to know where to start. Jamie, Nicole, and Dayna, you've both spoken about how you became your own best advocate and how you have your own way of ensuring that your whole person is engaged with your healthcare team. Jamie Nicole, was there a time when you've had to advocate for something specific, such as a change in treatment that you wanted to try?
Absolutely. It was my third diagnosis for the rheumatoid arthritis in 2023. And again, at this point, it had been a diagnosis or an issue every 4 years. I had already scheduled my surgery for my shoulders. I had already seen my primary care physician who referred me to my rheumatologist. But when I got to the doctor, because it did not start in my hands and my feet, they were hesitant to diagnose me. My lab results were positive for RA. I had a family history. I had symmetrical tears in my shoulders. But because of that reason, because it's not starting in my hands and my feet, they didn't want to diagnose me. For me, it gets kind of emotional even now. I was in between surgeries. And even though I was an advocate already, I cried in my bed for 2 days because I was depressed. I did not want it to get any worse. And I had seen other people where the rheumatoid arthritis had started in their shoulders. And I'm like, everything on my body and even in my mind with the narcolepsy is breaking down. If I can save anything, I needed to be this. And so it wasn't until after the first surgery where I wasn't recovering properly and I went in to get a steroid taper that I was finally diagnosed. And the outcome of that was that I was able to convince the doctor to let me monitor my hands and my feet every 6 months to make sure if there was an early progression, and he did see that in my hands and my feet, that we would be able to catch it. But had he not diagnosed me or addressed my concerns, had I not advocated for myself, had I not had my binder, and he had seen the past, 8 years of my MRIs and my X-rays where I had other joint issues that came out of nowhere, I wouldn't have been able to convince him that this is something that we needed to monitor going forward. And so both physically and mentally, I needed to be a strong advocate for myself because a diagnosis every 4 years when you think you have it under control takes a toll on you, I guess more so mentally than it does physically. So I would just encourage everyone, no matter what, to continue to advocate for yourself, no matter where you are in your journey.
Great. Thank you, Jamie Nicole. Your ability to advocate for yourself truly is so inspiring. Dayna, what advice would you give to someone who wants to speak up, but maybe worries that their doctor won't listen to them or take them seriously? And what strategies do you have based on your own personal experience?
That's a really sweet question. If I had to share, any just thoughts is firstly, I hear you. I feel for you. You're so valid in your feelings. You deserve to be taken seriously, and you are the expert of your own experiences. Your new doctor has known you for like 15 minutes, but you've lived with this chronic illness for 25 or however many years you've been alive. And like, yeah, sure, they have years and years of expertise, but they're here to learn from you and support you. So I know it's easier said than done, but I hope you feel empowered to take charge of your care and advocate for yourself. If you have the capacity, which I know is difficult with chronic illness, do your own research about your condition. I also understand that like internet access, free time are privileges. You can keep a list of questions and symptoms if you'd like, especially if you're someone who gets overwhelmed and anxious like me at doctor's appointments because there's so much going on. If you have a list of questions, it's okay. You can just read them. Other general advice is to seek advice from patient organizations. Like I mentioned, the Arthritis Foundation, where there's support groups for free online, and the National Psoriasis Foundation, both of which have given me advice on how to advocate for myself to doctors, how to keep track of my symptoms, how to ask for disability accommodations as needed, and strategies that work for me. Personally, I have a list of questions for each provider that I just keep adding to whenever I have them. I also reach out to them a lot through the electronic health portal for us. For us, it's called MyChart, and I just reach out to them with questions. And if I don't feel heard by the doctor in front of me, I'll go for a second opinion. Like, for example, one of the doctors said that my fatigue was not associated with my PSA when I'm not flaring, but the psoriatic disease expert says it totally is. Like when you're not flaring, your fatigue is still can't be associated with your psoriatic arthritis, and that was really validating.
Yeah, that's all really, really excellent. You bring up great points. And I think that everything that you shared is going to be so valuable for everybody out there who is going through this. You give very concrete examples. So thank you again for sharing that. Thanks to both of you, Jamie, Nicole, and Dayna, for opening up and bringing your lived experiences into this conversation. It's truly a gift to learn through your stories and what you've been through and what's worked for you. And Dr. Shah, we're so grateful for the insight and the compassion and the clarity you've shared with us today. Before we close, we'd love to leave our audience with something they can carry forward. Can you share one small but powerful step a patient can take away to begin reclaiming their total wellness?
Yeah, absolutely. So I just have to say, living with an autoimmune disease is hard and there's no perfect way to do it. So just keep that in mind. Progress isn't always going to be visible and healing isn't always going to be linear. So it's just important to hold on to that. Not every day is going to be a perfect day. But what matters most is that you keep showing up for yourself, even on the hard days. Give yourself grace. You're not failing, you're fighting something, and every day is going to be a little different. But really just make sure to continue paying attention to how you're feeling, to what works for you, what doesn't work for you, on the good days, on the bad days. That awareness is what's really going to allow you to take control of the whole picture. And then every choice is an intentional choice, right? So wellness becomes a journey that you're the leader in charge of at that point. So really honing in on your physical symptoms and how you feel on a day in day out basis, and leaning into the good, and trying to avoid, if you can, something that doesn't make your body or body feel good.
Absolutely. Thank you, Dr. Shaw. And thank you to everyone who joined us today. We're so glad you're here, and we hope that you found today's session valuable. You'll receive a follow up email with all of the resources and highlights from today's session and ways to stay involved. Please keep going, stay curious, and remember, you absolutely are not alone in your journey. We're here with you. Thank you again.